This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. Good evening, everyone. I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation.
A stroke is usually sudden. Attacks from out of the blue can often be fatal.
Ang ibig sabihin ng stroke ay may biglaang pagkasira ng mga cells sa utak, no? So maaaring nabara yung daanan ng dugo, yung daanan ng dugo nagsusupply ng oxygen. Pag nabara yung daanan ng dugo, mamamatay yung cells.
Experts usually refer to it as a brain attack and is often blamed to the narrowing of arteries from an accumulation of cholesterol.
Biglang nabulol or kaya biglang namanhid or nanghina isang parte ng katawan or bigla na lang nahimatay, no, nawala ng malay or kaya severe headache or biglang pasuray-suray na yung lakad.
Based on Philippine health statistics, diseases of the heart have been identified as the #1 cause of deaths in the country since 1990. In fact, 167,000 Filipinos die from a heart attack and stroke each year.
So it can happen to anyone, even to you and me, no? So now, younger na yung mga na-stroke, maaari sinabi mo nga yung lifestyle, madaming bisyo ngayon, no? Sigarilyo, alak, even drugs, no? And also the stressful condition in our workplace, kailangan healthy lifestyle, tamang diet, exercise, kung may mga sakit kayo, halimbawa high blood, diabetic kayo, may mga ibang sakit pa, no? So i-maintain yung medicine, magkonsulta parati sa doctor, and then iwasan ang bisyo.
How can you diminish the risk of a stroke? What disabilities can result from a stroke? What therapies are available to help rehabilitate patients who have suffered a stroke? Find out the answers tonight on MedTalk.
Joining us tonight is Dr. Artemio Rojas Jr., the immediate past president of the Stroke Society of the Philippines and the director of the Stroke Unit of the Medical City. Also with us tonight is Dr. Cristina San Jose, the president of the Stroke Society of the Philippines and the head of the Stroke Service Unit of the St. Luke's Medical Center, Quezon City. You may join the discussion by calling our hotline at 548-4678. Good evening, Doc Tina and Doc June. Welcome to MedTalk.
Good evening.
I understand this week is stroke.
It's a National Stroke or National Brain Attack Awareness Week in the Philippines.
So August is
August, the
National
third
Brain
week of
Awareness.
August.
And tonight you will help us understand and you will educate us on what exactly is the nature of a stroke. Ano bang nangyayari sa isang tao pag siya ay nagsasuffer ng stroke? Dr. June.
Yeah. Stroke is a brain attack. This is due to a disturbance in blood flow to the brain, resulting in different neurological deficit depending upon the parts of the brain that is affected. Now, stroke can be due to a blockage in the blood vessel, yung baradong ugat, or this could be due to a ruptured blood vessel. And depending again on the site, then patient can be disabled because of this illness. So this is an emergency that requires immediate treatment and immediate going into the hospital for proper care.
Yes,
May I
Dr.
add
Tina. Yes,
something?
please.
This is an example. This is like a model of the brain. And what we want to emphasize is the brain does not store anything. No? So wala siyang pagkukunan. So when a stroke happens, when the blood vessel gets blocked or pumutok, then there's no blood supply. So walang oxygen, walang glucose, and the brain cells die.
You mean that it doesn't store anything, unlike other parts of the body that store our fat,
Yes.
and that store liquids?
Yes.
This one does not store
Does not store anything. That's why the brain demands constant blood flow. And when a stroke occurs, doon nababara o natitigil yung pagdaloy ng dugo.
At pag nabara or natigil yung daloy ng dugo, this is, it can be It can cause paralysis. It
Yes.
can cause different manifestations of yung pagbabara dun sa
Oo.
particular part of the
Parang
brain.
yung nasabi nga ni Tina, itong harap na to is for movement. So in a patient who develops a stroke on this right side of the brain, they develop a left-sided weakness. On this side, numbness. This will be for vision. This will be for balance. Dito yung paggalaw ng mata. Dito yung hiwi na mukha. Dito yung paglunok at pagkahilo. So each part of the brain has special function. So depending on the blood vessel that was affected, yun yung manifestation ng stroke sa pasyente.
There are certain manifestations na na-mention nyo na parang heart attack din. What is the difference or the similarity of a stroke and the heart attack?
Una-una yung heart attack, it means ang naapektuhan is yung puso. Sa stroke, no, ang sinasabi natin is ang utak. It's atake rin, no, biglaan yung presentation, pero hindi ang puso, ang utak. Now, ang most common presentation ng pasyenteng may heart attack is pain. No? Pwedeng sumakit yung dibdib, biglang sakit na matindi, and yun nagpapadala sa kanila sa ospital. Sa stroke, pwedeng hindi pain. No? Pwedeng manhid ang isang parte ng katawan, pwedeng mahina, pwedeng bulol, pwedeng pagkabulag ng isang mata, o matinding sakit ng ulo. So, pwede rin may pain, pero depende nga no, kung anong part of the brain ang tatamaan. So, pwede silang magsabay, no, pero kung titingnan mo, iba yung atake. Yung isa atake sa puso, isa atake sa brain.
You mean sabay pwedeng mangyari at the same
Yes.
time sa isang individual?
Merong mga pasyente kaming nakikita na sabay, no, nagka-atake sa puso, at the same time, nagka-atake rin sa brain.
Doon sa heart attack, karaniwan baradong ugat. Compared to that, sa brain natin, it could be barado, but it can also be a rupture of a blood vessel. So, hindi kasing madaling i-diagnose. Kaya dapat humarurot sa hospital. Yun ang sinasabi.
So, to
namin.
immediately talaga.
Immediate.
No? Which brings
Don't
us
lose time.
to understanding the different types of strokes. I understand there are 3 types. Let's
Yes.
start with the ischemic.
Actually, dalawa yung major. No?
okay.
Pero yung pangalawa, pwede pang hatiin. So, yung una yung tinatawag ng ischemic. Ischemia means kulang sa daloy ng dugo dahil sa bara.
Okay.
Yung isa, yung tinatawag nating hemorrhagic. Hemorrhage means blood. So, yung ugat, pumutok. No? At yung blood na dapat nasa loob ng vessel, kumakalat sa utak. At dalawa pa yung subtype nun. Kaya nagiging 3.
Okay.
So, yung isa, yung blood, pwedeng kumalat mismo dito sa brain.
Okay.
Ang tawag namin intracerebral, sa loob. Meron naman na pag pumutok, yung blood, kumakalat dito sa bases, sa baba, dito sa covering ng brain. Ang tinatawag namin doon, subarachnoid hemorrhage. Medyo magkaiba yung dahilan ng dalawang klaseng stroke na to.
Again, depending on kung saan pumutok yung
Again,
blood
yun din.
vessel na yun. And then
At iba-iba rin nga pala ang ating treatment depende sa type, ng
Type ng
stroke.
stroke.
okay.
Kaya maselan talaga eh.
Oh, it's the most complex organ of the body, no?
I guess, ang mahirap intindihin ng brain,
Yeah.
pero unique din siya because you know that each part of the brain has a particular function. So, alam mo na merong isa na bahala nag-control sa isang part ng body. And as na masabi natin sa brain, yung capacity niya to learn and recover is talaga minsan magugulat ka na lang, no? Even for stroke patients na may have deficits, pag uwi, after some time, they recover. Because that's the capacity of the brain to recover and repair itself.
With immediate medical attention, no?
Ang outcome is also dependent on how fast patients are brought in the hospital.
So how fast patients are brought in the hospital, before bringing a patient to the hospital, we have to know the signs and the symptoms. So let's understand the signs and symptoms of ischemic, one who has had a
Siguro
ischemic
para
stroke.
sa stroke, for the lay people, we use yung acronym na FAST. F-A-S-T. F stands for face, tumingin sa salamin. If you see any facial asymmetry, baka may ngiwi. Arm, you raise the arm. You see if one arm is going down, or you may do an arm roll. If one is not moving, then there might be weakness of one side. And then speech. Subukan mo bang salita? Tingnan mo, pakinggan ng iba. Kung hindi ka maintindihan, utal ka, then yung T, time, you have to rush to the hospital. May I add, rush to a hospital, dapat sana yung merong makaprovide ng proper stroke service.
These signs or these symptoms of one who's suffering a stroke can mimic other medical conditions such as Bell's palsy, yung paralysis in a certain area of the face and not able to speak, no? Or nagsaslur na.
There are conditions that affect the brain also. So the manifestations may look like a stroke. No? Ang common dyan, yung minention mo nga na Bell's palsy, but that's a nerve problem, not a brain problem. Now, ang pwedeng magmukhang stroke would be tumors, no? May mga bukol sa brain, or minsan pwede rin mga meningitis or infection sa brain. Pero ang something that unique sa stroke is yung biglaan.
Okay.
Yung suddenness ng presentation ng pasyente. Kasi yun yung dahil sa biglang pagbara or biglang pagputok ng ugat.
Okay. And yung biglaang pagbara o pagputok ng ugat, is it brought about by a medical condition that has been lingering in the patient?
Well, pag ganyan, dapat we have to understand the risk factors for stroke. Well, there are two major types. Yung iba, modifiable. Yung isa, non-modifiable. Yung mga modifiable, yung age, sex, minsan, yung pagka-race natin, a history of previous stroke. Then, wala tayong magagawa. These patients are really prone to another stroke or to a stroke. Now, ang mas importante siguro, each of us should know ano yung mga modifiable risk factors. Alam natin lahat yan, parang similar to heart disease kasi blood vessel yan. So we talk about hypertension, diabetes, heart diseases, previous heart attack, o yung irregular heartbeat, mga lifestyle changes, di ba? Yan yung mga smoking, excessive alcohol, of course, yung cholesterol, pag tumataas ang ating cholesterol. Now, there are newer other risk factors like, of course, yung obesity, physical inactivity, and lately, even yung mga snoring. These are known risk factors that are associated with stroke. And if a patient or a subject knows that he has these risk factors, he has to cut down on this risk factor if he wants to avoid to have a stroke or do the proper management. So, lifestyle changes and then management, medicines.
Who should one see, before we cut to a break, who should one see to monitor all these conditions so it doesn't lead to a stroke? Doc Tina?
If you look at the risk factors like hypertension, diabetes, mataas na cholesterol, this can be managed by general physicians. So, kaya yon. Important really is not just detecting na may problema, but making sure that these medical conditions are adequately controlled. Yun yung problema. Minsan, nagagamot, pero hindi naman kontrolado talaga. So, mataas pa rin yung blood pressure, mataas pa rin yung cholesterol. So, we need adequate control of risk factors.
Okay, so general physician, but
siguro, I mean, depende, no? If you have cardiac conditions, then there may be some, siguro kung you want to go to a cardiologist, kung irregular yung heartbeat mo or meron kang congenital heart problems. But in general, no, the risk factors like hypertension, cholesterol can be managed by physicians.
Okay, thank you very much, Doc Tina. Doc June, we'll just cut to a break. You're watching MedTalk and we're talking about stroke.
According to the World Health Organization, or WHO, around 17 million people succumb to cardiovascular diseases annually. Most come from cases of heart attacks and strokes.
We're back here on MedTalk, still talking about stroke. You may join our discussion by calling the hotline at 548-4678. Now, doctors, based on your practice, I'm sure you have patients who come to you with all these myths that surround your specialty, which is stroke patients, no? So let's start off with myth number 1, Doc Tina, Doc June. Stroke only happens to the elderly.
Well, tunay yun, that stroke at age is a major risk factors that we cannot change talaga. But you'll be surprised now because we have lots of younger patients who develop stroke. So we call it stroke in the young. Okay, these patients probably would be surprised that they suddenly develop all this weakness, numbness that we're talking about. But then, ang palaging workup, ang problema nun is, what is the reason for their stroke?
Yes.
So there are many causes, but among them, of course, we like to look at the heart. Baka merong abnormality sa heart nila, yung mga rheumatic heart diseases. Lifestyle changes, of course. Andun yung mga alam na natin as smoking, excessive alcohol at a young age. Of course, yung mga use of drugs. So that's important because now, siyempre, nababalitaan natin yan, young patients, very healthy, would suddenly develop a stroke. They are using drugs or, things that we should not be using. And then, of course, we also look about infections. Remember, in the Philippines, we still have TB. These can also develop stroke. And lately, because of HIV, you can also develop a stroke. So depending on the age, meron mga particular na reasons for their stroke. But it can happen in the young, not only in the elderly.
When you say young,
What age group is
yung
this?
mention ni Dr. Rojas na young, it's young adults. It's less than 45 years old.
Okay, so can start at 20? Can
Yes.
a 20-year-old
Yes.
suffer from a stroke?
Of course, there are also, of course, the other type of stroke, yung nag-rupture ang blood vessel.
Yes.
And this could be due to a abnormality in the blood vessel in the brain that has been there since a very young age na nagkataon at that age of 20, doon nag-rupture. So, pwede yan. Depende kasi nung bata pa pala, meron na silang gano'n.
So at the age of 20, may nag-trigger for that
Yes.
blood vessel to rupture.
That's right. So, the abnormality may have been there when they were born. Doon lang
So genetic then,
nagpa-
Doc.
That's right.
Yes.
That can
Okay.
happen.
It can happen.
Okay, myth number 2, strokes aren't preventable.
Okay, that is exactly not true, no? Because we actually changed. Stroke used to be known as CVA, cerebrovascular accident.
Okay.
But now there has been a change to a term known as CVD, cerebrovascular disease. Because an accident, parang pag naisip mo yung aksidente, biglaan kasi wala kang nagawa.
Yes.
But when you say disease, it may happen suddenly, but the risk factors have been there for a long time. So if you know the risk factors, then that's the time to best manage this to prevent a stroke.
Okay.
So we're saying nothing is accidental sa stroke.
Okay. All right. The most common sign of a stroke is chest pain. Napag-usapan natin to earlier, which
Chest pain, di ba sabi natin heart attack ito, no?
Yes.
Sa brain, pwede rin sumakit ang ulo pag yung nag-rupture ang blood vessel. But many of them would develop yung mga weakness, sudden. Palagi ang magic word yan is sudden onset. Unexpectedly, you're unable to move one side of your body, you can't feel, you can't speak, you can talk, you can see. Always think of stroke.
Okay. Yung pain sa stroke is mas common sa hemorrhagic type. No, because the blood supposed to be nasa loob ng ugat. No, because pumutok siya, kumalat sa brain. And that causes yung reaction sa brain. It causes, kaya yung mga patients would complain of headache or they would cause yung tinatawag natin increased pressure sa brain. No, because of that clot na namuong dugo sa brain, then that causes yung headache. So sa infarct, hindi gaanong ka-common ang headache. Mas common yung numbness na sinasabi ni Dr. Rojas, yung weakness, pagkabulo ng pagsalita.
So if you're alone and this happens to you, so you can't talk, you're numb, what should you do?
Kung ikaw lang yung nag-iisa,
Yes.
mahirap talaga, no? Kasi sana meron tayo yung mga 911 na baka makapindot ka pa, no?
Right.
Pero kung mag-isa ka talagang walang magagawa. Pero of course, people who would come to your rescue, ang kanilang dapat gawin is dalhin ka agad sa ospital. Yun talaga.
Yun yung minsan napapansin, no? Yung pag dinala sa ospital, ang kwento is yung nga nakita sa bahay na mag-isa.
Yes.
No, hindi alam kung anong eksaktong oras nangyari. Or minsan napansin na hindi lumalabas sa kwarto. Normally, ganitong oras siya dapat lumalabas. Then doon minsan napipick up. Yun yung problema minsan. Nagkokos talaga ng delay sa recognition ng stroke.
Number 4, myth number 4, doctors, stroke recovery only happens in the first few months after a stroke.
Well, that's not true, ano? Kaya nga tayo may rehabilitation. Of course, we always say na during the first 6 months, siguro doon talaga yung peak na dapat natin makuha yung recovery natin. But recovery still occurs even after the 6 months, even after 1 year, or even after 2 years. So meron din tayong mga parang meron tayong process of regeneration. Okay? Tayong mga neuroplasticity ng brain. That's a very important topic.
Yes.
Kasi nung dati sabi natin, pag ang ating neurons nasira na, wala nang pag-asa for recovery. But now we see patients with proper rehabilitation, they are still able to recover. But we have to make really the most during the first few months to get a jolt para sa recovery nila. So rehabilitation medicine, very important.
Yung sinasabi ni Dr. Rojas na neuroplasticity, yung capacity ng brain not only to regenerate,
Okay.
but yung other parts of the brain to take over the function. So sinasabi natin, yung control nung speech natin is more common sa left side, but they found out na minsan sa mga pasyente nagsustroke and they did some test, nagla-light up yung kabilang side. So some parts take over the damaged area. Or sometimes yung brain natin forms new pathways. So yung dating hindi kailangan, so nabubuo siya dahil sa nangyaring damage. So remarkable. Kaya yung capacity of the brain to recover is really immense. No? Pero of course, the earlier start intervention, the better the outcome.
And again, as mentioned earlier, it depends kung anong part
Part of
ng
the
brain yung natamaan, which is also very vital in the patient's recovery. No? Dr. Smith, number 5. If stroke symptoms pass, you don't need treatment.
When you say, I think ang ibig sabihin ng pass is nawala.
Oo. Like for example, a headache. Or what symptoms na pwede mong palampasin that might lead to a stroke?
Ang common dyan yung namanhid, yung kalahating parte ng katawan, pero panandalian lang, within minutes or within hours, biglang bumalik sa normal. Ayun ang pagkaintindi ko dun sa
Okay,
past.
yes.
Tawag namin dyan is TIA, Transient Ischemic Attack, which is also a stroke. No, nabarahan yung ugat, but swerte, by itself, nagbukas siya, and no permanent damage has occurred. Okay. So, wala kang permanent. No? Nag-recover ulit yung lakas or yung pakiramdam. Pero hindi ibig sabihin yun na hindi ka na magpapatingin. It's actually one of the warning signs. No? About 30% of patients na may ganong simptomas will end up with a major stroke. So, yun yung mas maganda talagang pumunta na sa doktor, maagapan.
Kaya lang mas magandang pasyente.
Yes.
Yung hindi pa talaga nag-i-stroke. Kasi you can predict that in the next 5 years, about 30 to 40% of them will develop a real stroke. So why wait for it? Dapat nga i-work up muna. These are the nice patients to really take care of. So you want to prevent the first stroke. Meron tayong primary prevention, merong secondary prevention dito. At atin sana hindi tayo umabot sa first stroke. Kasi pag nag-first stroke na tayo, of course, andun palaging there's a higher chance of stroke recurrence.
Yes. Sometimes kasi yung like the example na pangangalay tapos nawawala after a while, it's also the activity that the person is engaged in. Maybe masyado nang matagal yung pag-use niya ng kanyang kamay or maybe pag-use niya ng kanyang katawan, no?
Yun yung problema minsan if ang presentation is numbness. Yung pamamanhid o pangangalay na minsan nami-misinterpret dahil lang nadaganan. No? Pero minsan, no, makikita mo talaga na ano yun kasi hindi lang yung kamay, pati yung paa, minsan pati muka. So, kabiyak, one side manhid or one side mahina, hindi na siguro ngawit yun. Naka-stroke na yun.
But when in doubt,
Rush to the
emergency
room right away. When you get to the emergency room, do you request for a neurologist right away?
well, of course, depende sa ospital. Diba? It's usually the emergency room doctors who assess the patient. So if they think that this is a patient with stroke, then of course, the neurologist will be the best specialty to treat this case. Now, may time tayong inahabol dito. Nasasabi kanina pang very critical time because depending on the type of stroke, like sabi natin dun sa baradong ugat, there will be patients who, if they come in within 3 hours, okay, meron pwedeng ibigay. Sabi natin, may baradon. So why don't we remove that clot? So meron mga clot buster na gamot. So now, stroke is treatable. Yun ang importante rin. But you have to choose the right patients, and not all hospitals will be able to provide this form of treatment. That's why when I said earlier, if preferably, if you're going to rush to a hospital, try to go to a hospital na merong organized stroke care. Yung tinatawag nila sana merong stroke unit. Talagang yun, talagang they know the protocol. Of course, merong mga iba nag-extend ng 4.5 hours, but sabi namin hindi. try to go immediately, sana before the third hour. Okay? Of course, not all patients will receive the medication, but it is up to the doctor and the neurologist to decide sila ba yung right patient for this medication. But aside from that, meron namang ibang care na magagawa ang ating doctor, not just limited to that medicine.
Okay. Okay, so pwedeng medication ka agad.
That's right.
Do they have to undergo like a CT scan or an MRI right away as well?
Yes. Kasi nga we mentioned about types of stroke, and the only way to know that, is to differentiate that, is do imaging.
Yes.
So silipin yung brain, so an CT scan or an MRI, or baka nga sabi natin, baka mimicker, hindi talaga stroke, so you really need to do some tests to confirm the diagnosis.
Okay, thank you, Doc Tina. Doc June, we'll take a short break. MedTalk will be right back.
Today, stroke has not only been tagged as a disease of the elderly, it has also affected younger people in the last few years, with more youngsters suffering from diabetes, obesity, and high blood pressure. Only 33 years old, Antoinette Maniquis is already a stroke survivor.
Hindi kasi ako mahiluhin na tao. So, yun yung una ko naramdaman. Sobrang lightheaded. And then, all of a sudden, parang one side of my body, medyo weak na siya. Parang mas heavier than usual. So, sabi ko, ba't ganon? Pero binaliwala ko kasi I was young. I was 32 kasi. So, baka lang pagod. Yun yung naisip ko.
Antoinette recalled feeling dizzy and numb. She was rushed to the hospital where she further exhibited signs and symptoms of stroke, such as lapses in thinking and loss of coordination.
Yung sa emergency, they were surprised na nakakalakad pa daw ako kasi ang taas nga ng BP. Sabi nila, mag-rest ka lang, but ang initial nila is, sabi nila, we think it's stroke.
She has currently shown promising signs of recovery after taking medications and undergoing therapy.
You have to make wiser choices now with the food you eat and also your sleeping habit. Na yun din yung nakasama kasi nga stress can really cause it talaga. Sabi niya, you have to sleep by 9 or 10 in the evening, and then sabi niya, at least have 8 hours of sleep. Kailangan parang you have to think about yourself na do you want to live longer or gusto mo na bang matapos yung buhay mo? Importante na mabuhay ka longer. Masyado nga akong bata para ma-stroke, pero nangyari na so wala na akong magagawa.
We're back here on MedTalk, still talking about stroke. You may join the discussion by calling our hotline at 548-4678. Doc Tina, Doc June, we saw the video. Antoinette, at a very young age, 32, suffered a stroke, recovered. I mean, she's baking again. Yeah. She's using her hands again. She's speaking again. What can you say based on the video?
It might be unang-una, she might have come early, so that might have impacted na maganda yung outcome niya. Secondly is, again, that type of the stroke, no? Baka maliit lang yung part of the brain that was affected, so the recovery was good. Now, most of the patients naman will really recover, no? But the functionality will really depend a lot on the type of stroke and the part of the brain that's affected.
So definitely, there's life after stroke. Yung sa kanya, parang very mild lang, maswerte naman. Kasi talagang yung mga iba, they're not able to walk. They're talagang, stroke is a very disabling, it's actually the leading cause of disability. People are no longer able to go back to work.
Yes.
Diba? So, maswerte siya. Well, of course, she was able to go and rush immediately to the hospital, and they were able to work her up and treat her accordingly, and siguro nag-undergo siya ng therapy. So, tama yung kanyang approach. But again, of course, yung mga risk factors, yun na naman ang ating iti-treat. Kasi your next goal now is how can we prevent another stroke?
Because it can happen again. Even if you've been treated, it can recur.
Yes, and problema kasi she's young. So, prime of her life, working. So, sinabi nga ni Dr. Rojas, there's life after stroke. So, life does not stop after an attack of stroke. Ang goal natin is get them to the best, yung best functional outcome. Recovery might not be total, full recovery, but at least the best outcome possible. Yun yung goal natin. But as important is, again, preventing a recurrence. Kasi imagine na stroke ka na once in a part of the brain, dagdagan mo pa ng another stroke na maaring sa ibang part of the brain naman. So the recovery then may not be as good as the first one.
Okay. So
And it does not just affect the patient, yung family niya, yung mga caregivers niya, and of course, eventually, yung society. So it's a very disabling condition.
Doctors, we have a caller on the line. Good evening, Professor Rene Viado. Good evening, Professor.
Good evening.
Hi. Your question, please, for our doctors. Go ahead, Professor.
Yes, good evening also.
Yes.
Doctors, can you kindly define or give us the meaning of pacemaker?
Well, ang pacemaker ay isang makina na inilalagay sa puso in order para maging regular yung ating rhythm. But this is, again, hindi to sa stroke. Kaya ang stroke natin is a brain attack, while sa puso naman, andun yung may heart attack, pero may mga ibang pasyente nangangailangan ng proper cardiac rhythm. Yun yung ginagamit nila. So, mga cardiologists ang gumagawa niyan. Pero sa stroke, wala ho kaming parang pacemaker. Wala kaming ganung device.
Professor Viado?
How about doctors? Thank you. Doctors, how about, yes, doctors, how about this, the relevance of stem cell to stroke victims or stroke patients?
Kulang pa, no? Pinag-aaralan pa. So, yun lang yung siguro masasabi namin. At this point, na nakita na may chance sa mag-recover, pero ang problema sa stroke is, anong klase yung dapat, no? Kung ano yung magre-regenerate, yun ang medyo mahirap pa. Hindi pa nila ma-determine exactly ano yung cell na magre-regenerate, no? Iba-iba ang cells ang sa brain natin. So, kung saan siya mapunta ba siya doon sa part na nasira, tsaka yung function niya. So, at the moment, panay pag-aaral pa. Hindi pa siya approved for stroke.
Okay. Thank you very much, Doc Tina. Professor Viado, are you still on the line?
Last question, doctor.
Please go ahead.
Last question, doctor. Very competent answers. Very competent answers. Last question, doctor.
Please go ahead.
How about this non-invasive treatment in relation to heart victim, stroke victim, or
Non-invasive.
or patient?
Thank you, Professor Viado. Non-invasive treatment for
Sa aneurysm
stroke
din.
patients. Dr. June?
Well, siguro yung sinasabi niya yung mga interventional na this time not in the heart, but sa brain. So there are things like that, yung tinatawag namin na parang kung ang pasyente merong aneurysm, that means merong abnormal na blood vessel na rupture because of a pathological outpouching in the blood vessel, nag-rupture siya. Before, you would go for surgery, open up the brain. But this time, meron mga interventional doctors, they put their catheter and put something there in order to repair. So that's a form of parang non-invasive procedure. Okay, sometimes too, if you have a black vessel in the neck, there are also stenting. Okay, sa puso may stenting din. Same principle din dito, parang bubuksan yung baradong ugat. Again, it always depends on the proper choice of patient. Sino yung pasyenteng mangangailangan niya. And that is, of course, on top of medical management too. Okay? So, importante yung medical management din.
Thank you, Dr. June. Thank you, Professor Viado. Maraming salamat.
Thank you, Professor.
Thank you. Dr. June, you mentioned the neck.
Yep.
Is neck manipulation, is it a factor in a patient suffering from a stroke?
Remember, sabi natin, ang brain needs proper amount of blood. And this is delivered from the heart by 2 vessels on the left, 2 vessels on the right. Now, pag ito mabara o kaya ma-traumatize mo,
Yes.
kaya meron tinatawag kaming carotid dissection. When you manipulate the neck, sometimes because of too much manipulation or even an injury, then pwede magka-depekto dun sa blood vessel. And sometimes, when that blood vessel is hurt, pwede mong masugatan, and because of that sugat, parang merong, because of the pressure of the blood, pwede siyang dun sa wall ng blood vessel, magpasok doon, and that can cause hematoma, and yung lumen, yung butas, biglang masasaraan. Dahil kasi nga may hematoma doon. Yung mga nadidinig natin kuminsan, yung mga beauty parlor, yung nagpapa-stretch, nagpapa-shampoo na sobra-sobra, matagal na matagal. Kung lalo na kung kung ma-traumatize mo yon, then pwede ka magka-stroke. So, merong iba trauma, pero merong iba spontaneous. So, yung mga atherosclerotic blood vessel mo na. Yung sinasabi ko kanina na traumatized, that can be prevented. Kaya yung mga manipulation, you don't want to do that.
Not this area, no?
Not
At the major
lalo
area.
na dito yung sa likod, yung meron tayong tinatawag na vertebral artery na ang lumulusot siya talaga dito sa buto natin dito sa likod. So, pwede siyang mapunit kapag yung alam ko, nagpapagupit ang mga lalaki at pinapatunog yung leeg pakatapos.
Yes.
Pwede siyang mapunit. Or sa spa. Minsan sa spa, minsan na mali ang pagka-manipulate ng neck, pwedeng mapunit.
Okay. Thank you for that warning, Doc Tina. Doc June, we have another caller on the line, Leslie. Good evening, Leslie.
Good evening.
Hi. Your question for our doctors. Please go ahead.
Yes. Yes, I had brain aneurysm 2012. Ruptured middle cerebral. Ruptured right middle cerebral artery.
Okay.
Yes. Until now, I am suffering from neurospasticity. I have undergone rehabilitation. Yes, but I'm still suffering from pain on walking, my left foot.
Okay. Yes, Leslie?
Yes.
Your question, so you have pain on your left foot?
Yes. Neurospasticity.
Okay.
So, I guess
Yes. I have
Sa
taken
post-spasticity.
tricyclic antidepressants.
Okay.
Gabapentin and pregabalin.
anticonvulsants. Okay. I think yung mini-mention ni Leslie is yung epekto ng stroke. So, pag sinabi nating spastic, no, yung recovery kasi ng stroke, kunyari mahina, yung iba, totally wala nang galaw. But some naman, pag nag-recover, nagiging excessive. So, nagiging matigas. So, makikita mo sila, nakabaluktot yung kamay, yung paa naka-extend. And that may cause pain kasi nakakontract talaga yung extremities. Na yung binanggit na gamot are medical treatments yon, no? Nagbibigay kami ng anticonvulsant, we give muscle relaxants, and therapy, no? Yung rehabilitation therapy helps reduce the spasticity. But minsan nga, not enough ito. So, meron ngayon yung iba na may mga ibang specialist na neurologist or ibang rehab specialist, they do injection. Nag-injection sila ng botulinum toxin.
Okay.
So,
to loosen up
to
the
loosen
area.
up. Yes. But that treatment is not permanent. No? After a while, mag-wear off and babalik yung spasticity. So, yun yung problema.
So her stroke happened in, she's not on the line anymore, but based on her
2012.
sharing, no? 2012, so 2 years ago.
2 years ago.
Is that normal for a stroke patient to experience what she has just mentioned?
Isa sa mga komplikasyon yun ng stroke. So, first, you're left with a weakness on one side, then later on, ang pagmatagal na, ito naman yung nagiging matigas. Kaya nga talagang rehabilitation yan na dapat gawin. Pero apparently, repaired na yung kanyang aneurysm, ito na lang yung mga natira, yung mga epekto ng
Tawag
stroke
natin
niya.
parang sequela.
Oo.
Merong natira. So yung sinabi natin, not fully recovered, no, and may natirang epekto ng stroke.
Will a stroke patient fully recover?
Meron.
Like talagang going back
Yes.
to
Meron naman.
the brain function and then the other functions of the body?
Yes, meron naman. Eh, minsan makikita mo sila, parang hindi ka makapaniwala nagka-stroke sila. So again, maraming factors yan, no? Kung, in general, mas bata, mas maganda yung form of recovery. Kung wala kang diabetes, mas maganda. Again, kung anong klaseng stroke, no? And anong part of
no?
the brain ang tinamaan. And kung nagawan ka, no, if you're able to receive the proper treatment ng maaga, mas maganda ang chance for full recovery.
Kung, let's say, you know, there's a certain area of the brain na natamaan, you were brought to the hospital right away, but parang the functions of your body aren't yet in full swing. All the signs and the symptoms and all the, how do you call that, the immediate medical attention was given. Pero meron bang mga patients who are given the immediate medical attention but are not able to function as our, you know, our case study, Antoinette, and as our caller earlier?
Yes, sabi nga, no, depende nga sa extent, anong part ng brain, ilang taon yung pasyente, ilang oras bago nadala sa ospital. All of this matters. But then, kahit na with the best effort, talagang meron talaga tayong mga pasyente na everything na ginawa na, meron pa ring deficit. So talagang prevention talaga ang mas maganda.
Sa yung sinasabi nga namin, that best treatment is really prevention. So prevent it from happening. Kasi even the best treatment is not 100%. We may improve the outcome, but it will not guarantee 100% total recovery.
Can an individual, before we cut to a break, can an individual go to the hospital to have their brain activity monitored?
Baka hindi naman brain activity kasi
Oh,
siyempre
kasi
you think about machines, ano?
Yes, or like
Magsustroke ba o hindi?
Yes.
Baka sometimes baka naman napakamahal gawin yung mga test na yun kung wala namang simptoma.
Okay.
But then, when you go to your doctor, yung tinatawag nilang risk assessment.
Okay.
So they check everything, yung mga risk factors mo, your lifestyle, then they give you the proper kung minsan pag may nakitang baka may mga symptoms na to, na paghihilo, baka kailangan pag-aralan yung mga ugat. Doon papasok yung decision na, okay, let's do more tests.
It's probably may not be the brain yung i-monitor, pero titingnan na yung mga ugat. Titingnan na yung puso, tingnan na yung heart, yung rhythm ng heart.
Kasama lahat yan sa executive check-up, no?
Depende sa package.
Depende sa package. Okay, we should always include it in the package. We'll talk more about stroke when MedTalk returns.
Did you know that roughly 2% of Filipinos are at risk of suffering from strokes and other attacks caused by atrial fibrillation? Atrial fibrillation is often viewed as a precursor to numerous cardiovascular complications.
We're back here on MedTalk, still talking about stroke. This time, Dr. June, Dr. Tina, we have another caller on the line, Don Pacheco. Good evening, Don.
Good evening.
Hi.
I am good evening.
Good evening.
I am 66 years old, you know, and my stroke came as a result of, I am basically diabetic. And then also, yung stroke ko nangyari because of constipation. I had a problem on the releasing what I had in my bowels, and then because of that, pinilit ko, and then yung BP ko tumaas ng husto, and then boom, nandun na, tinamaan na ako ng stroke. I have been in physical therapy dito sa Parañaque Doctors Hospital. They have very good staff there. And I have 6 months now, and then I noticed that those who are, I could walk already, and then I could talk quite intelligibly, and then I think it might be part of my brain that was affected, but not my memory, fortunately. Now, I have noticed that certain areas now of my brain, I could recall, it improved my memory, and at the same time, I could understand clearer now than before. But what I noticed in those doing physical therapy, they've been there for years, maybe 5 years, 7 years, 10 years, and a lot of them maybe have died meanwhile already. But I noticed that their problem is they don't have enough nutrition. Nutrition is critical in recovery. I am taking a very good nutrition product, which helps me in my control of my diabetes, and then it makes me very strong in order to recover quickly. Those together with me taking therapy, kawawa naman kasi either they could not afford to get the proper nutrition, or they just don't know, or the doctor doesn't advise them on proper nutrition.
Mr. Pacheco, so you've shared with us your experience and what you've observed around you. Please go ahead with your question for our doctors, Dr. June and
My
Dr.
question is, what is the best nutrition for those who suffer stroke?
Thank you very much, Mr. Pacheco. Doc June, best nutrition.
Well, of course, congratulations, Don, kasi mukhang you are able already to recover. And then you were saying about yung mga ibang pasyente, parang iba yung kanilang recovery. So very important na it's difficult to compare one stroke to another kasi iba-iba yung condition. So kung minsan nakakalungkot, ba't siya mas mabilis gumaling, yung isa hindi. Kasi hindi nga comparable lahat yan. Okay? So regarding the best nutrition, of course, depende yan. Kasi like you, sabi nyo nga, diabetic tayo doon. Then of course, kailangan dyan yung proper nutrition related to diabetes. It depends also kung mataas ang ating cholesterol, then we have to use the proper diet for cholesterol aside from medication. Okay? So yung tinatawag din ng low cholesterol diet. Kung high blood naman, low sodium diet or low fat diet for matataas yung cholesterol. So, of course, proper nutrition. Andyan palagi yung mga vegetable. They always recommend fish. Okay? And then, exercise. Kung kaya pa natin yan, of course, we have to include that also. Not just nutrition, but also exercise. Okay? So, yun yung general na ginagawa natin. But again, congratulations po, Mr. Pacheco.
Yes.
Mukhang it seems that you were able to recover. That's life after stroke. There's life after stroke.
Very nice. Doc Tina, you'd like to add to that?
Yeah, yung nutrition will really be, ang tawag namin doon, individualized. So, meron, you really have, may general guideline na you avoid yung mga fatty food, limit yung alcohol. If you're drinking, if you're not drinking, do not drink alcohol. Prefer yung fish. But sometimes, depending nga kung anong risk factor mo. If you're diabetic, you're hypertensive, you might have to have a tailor-fit diet. So maganda yun, kinakalculate din yun ng nutritionist minsan.
Okay. Mr. Pacheco mentioned blood pressure. Blood pressure in relation to a stroke. Doc Tina?
I'll just shift dun sa yung nangyayaring stroke.
We'd like to thank Mr. Pacheco for calling. Okay, Doc Tina.
Not as a risk factor, but kunwari, no, pag nagka-stroke ang pasyente, madalas tataas ang blood pressure. About 70% of the time, tataas yung BP because na-mention nga natin, dahil sa pagkakulang ng dugo sa brain, compensation ng katawan na tumaas ang blood pressure. That's a compensatory response. Ang nakikita namin unfortunately, maraming pasyente, because they're taking medications for their hypertension, ang first aid nila is iinumin yun. Or there may be some physicians, ganun din, dahil mataas yung blood pressure, papababain, which we really don't want in acute stroke. No, minsan, we want that BP to be high as a way of compensation nga. Nakakatulong siya. Okay. But we have guidelines. So, kung pag sobra naman taas, then we will give treatment. So, meron kaming guidelines. So, kung sa mga pasyente na nanonood ngayon, no, sana po, wag niyong inumin yung mga gamot niyo for hypertension during the acute attack. Ang first aid lang talaga is go to the hospital. Okay. Minsan pa nga, may problema sa paglunok, mabilaukan pa minsan pag inom ng gamot. Mas dagdag pa sa problema. Okay.
So, when you talk about blood pressure, depende kung anong phase ng stroke. Yung sinasabi ni Dr. Tina, ito yung acute phase of stroke. Parang pinapabayaan natin, sige, para ang katawan yun, para itulak ang dugo doon sa nabarhan na lugar. Pero after that, doon tayo naman sa secondary prevention of stroke. Doon papasok ngayon yung adequate blood pressure control through diet as well as through medication. Okay? So, depende yan. Kung acute, chronic, depende rin sa type of stroke, kuminsan, like kung bleed at saka barado or putok. So, iba-iba yan.
Okay. So, kung depende rin sa type of stroke. So, hindi porket tumaas ang iyong, like what you've mentioned, no? Tumaas yung blood pressure mo, yung immediate knee-jerk reaction mo is to take that. Pero sa inyo, mga neurologist, gusto nyong malaman kung ano talaga yung kanilang blood pressure minsan, at the time of the acute attack.
Minsan, mas maganda nga pag mataas. Kasi alam namin yung brain, yung heart is able to compensate. So, minsan, yung mga patients na may problema sa puso, hindi makakompensate. So, pag dumating sila, mababa yung blood pressure. Minsan, hindi mas maganda yung outcome. So, case to case talaga. So, ang best talaga is go to the hospital.
So, on the other hand, kung ito naman ay pumutok na ugat, ayaw naman natin ng mataas na blood pressure kasi lalabas ang dugo talaga doon. Okay. So, dapat talaga makita ng doktor, ma-assess kung anong klase, kaya yung type of stroke, importante yan.
And in your assessment, anong mga nire-recommend nyo sa inyong mga patients? Final words, Doc Tina. How should we take care of our brain? You know, we take care of the other parts of our body. Talagang, yung how do you call it? Yung talagang nakatutok. To take good care of the other parts. How about our brain? Na minsan nakakalimutan natin that it is a very integral part of our well-being.
The way you take care of the brain is how you take care of your body. So remember yung risk factors natin. It's not specific for the brain. Yung hypertension, diabetes, cholesterol. So ang lagi lang sinasabi namin, live a healthy lifestyle. That's one effective way of preventing stroke.
Okay.
Segue din ako ng kaunti, no?
Yes, of course.
Kasi yung stroke, sabi natin, it's the leading cause of disability, the second leading cause of death worldwide in the Philippines, but it's also the second leading cause of dementia. Yun yung sequelae na pwede rin na yung mga pasyente may dementia, makakalimutin, hindi na alam ang mga bagay-bagay.
Yes.
Ang second cause nun ay stroke, lalo na kung multiple stroke.
Doctors, before we close this episode, you brought a book with you.
Yeah. Merong mga guidelines po ng mga society. Our last guideline was way back in 2010. So now it's 2014. We actually have released our 6th edition of the Handbook on Stroke. This will contain all the things that are new, up-to-date, evidence-based treatment for stroke, which is good not only for doctors, but also for nurses, therapists, and even lay people. Yung ating society rin, meron kaming video rin dito, and you can actually call our office or through our website too, you can get in touch with us. This contains lots of videos on the types of stroke, and including diet, understanding aphasia, rehabilitation, risk factor assessment. So, baka makakatulong sa mga magkaka-interest, they can call on Stroke Society of the Philippines or through our website. Okay. Ang aming telephone number, you might like to know, is 722-5877.
Okay, so the Stroke Society of the Philippines.
That's right.
So thank you very much, Doc Tina. Thank you very much, Doc June. And, you know, it's always valuable information to educate not only myself, but of course all our viewers on how to take good care of themselves para maiwasan natin ang stroke.
Thank you din.
Thank you very much. And thank you to all those who called and to all those who watched. See you again next Tuesday, 7 p.m. here on MedTalk, your scheduled on-air consultation. This is Angel Jacob. Good night. This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. Good evening, everyone. I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation.
A stroke is usually sudden. Attacks from out of the blue can often be fatal.
Ang ibig sabihin ng stroke ay may biglaang pagkasira ng mga cells sa utak, no? So maaaring nabara yung daanan ng dugo, yung daanan ng dugo nagsusupply ng oxygen. Pag nabara yung daanan ng dugo, mamamatay yung cells.
Experts usually refer to it as a brain attack and is often blamed to the narrowing of arteries from an accumulation of cholesterol.
Biglang nabulol or kaya biglang namanhid or nanghina isang parte ng katawan or bigla na lang nahimatay, no, nawala ng malay or kaya severe headache or biglang pasuray-suray na yung lakad.
Based on Philippine health statistics, diseases of the heart have been identified as the #1 cause of deaths in the country since 1990. In fact, 167,000 Filipinos die from a heart attack and stroke each year.
So it can happen to anyone, even to you and me, no? So now, younger na yung mga na-stroke, maari sinabi mo nga yung lifestyle, madaming bisyo ngayon, no? Sigarilyo, alak, even drugs, no? And also the stressful condition in our workplace, kailangan healthy lifestyle, tamang diet, exercise, kung may mga sakit kayo, halimbawa high blood, diabetic kayo, may mga ibang sakit pa, no? So i-maintain yung medicine, magkonsulta parati sa doctor, and then iwasan ang bisyo.
How can you diminish the risk of a stroke? What disabilities can result from a stroke? What therapies are available to help rehabilitate patients who have suffered a stroke? Find out the answers tonight on MedTalk.
Joining us tonight is Dr. Artemio Rojas Jr., the immediate past president of the Stroke Society of the Philippines and the director of the Stroke Unit of the Medical City. Also with us tonight is Dr. Cristina San Jose, the president of the Stroke Society of the Philippines and the head of the Stroke Service Unit of the St. Luke's Medical Center, Quezon City. You may join the discussion by calling our hotline at 548-4678. Good evening, Doc Tina and Doc June. Welcome to MedTalk.
Good evening.
I understand this week is stroke...
It's a National Stroke or National Brain Attack Awareness Week in the Philippines.
So August is
August, the
National
third
Brain
week of
Awareness.
August.
And tonight, you will help us understand and you will educate us on what exactly is the nature of a stroke. Ano bang nangyayari sa isang tao pag siya ay nagsasuffer ng stroke? Dr. June.
Stroke is a brain attack. This is due to a disturbance in blood flow to the brain resulting in different neurological deficit. Depende nga ni Tina, itong harap na to is for movement. So in a patient who develops a stroke on this right side of the brain, they develop a left-sided weakness. On this side, numbness. This will be for vision. This will be for balance. Dito yung paggalaw ng mata. Dito yung hiwi na mukha. Dito yung pagluno at pagkahilo. So each part of the brain has special function. So depending on the blood vessel that was affected, yun yung manifestation ng stroke sa pasyente.
There are certain manifestations na na-mention nyo na parang heart attack din. What is the difference or the similarity of a stroke and the heart attack?
Una-una yung heart attack, it means ang naapektuhan is yung puso. Sa stroke, no, ang sinasabi natin is ang utak. It's atake rin, no, biglaan yung presentation, pero hindi ang puso, ang utak. Now, ang most common presentation ng pasyenteng may heart attack is pain. No? Pwedeng sumakit yung dibdib, biglang sakit na matindi, and yun nagpapadala sa kanila sa ospital. Sa stroke, pwedeng hindi pain. No? Pwedeng manhid ang isang parte ng katawan, pwedeng mahina, pwedeng bulol, pwedeng pagkabulag ng isang mata, o matinding sakit ng ulo. So, pwede rin may pain.
Depending upon the parts of the brain that is affected. Now, stroke can be due to a blockage in the blood vessel, yung baradong ugat, or this could be due to a ruptured blood vessel. And depending again on the site, then patient can be disabled because of this illness. So this is an emergency that requires immediate treatment and immediate going into the hospital for proper care.
Yes,
May I
Dr. Tina.
add
Yes,
something?
please.
This is an example. This is like a model of the brain. And what we want to emphasize is the brain does not store anything. No? So wala siyang pagkukunan. So when a stroke happens, when the blood vessel gets blocked or pumutok, then there's no blood supply. So walang oxygen, walang glucose, and the brain cells die.
You mean that it doesn't store anything, unlike other parts of the body that store our fat,
Yes.
and that store liquids?
Yes.
This one does not store
Does not store anything. That's why the brain demands constant blood flow. And when a stroke occurs, doon nababara o natitigil yung pagdaloy ng dugo.
At pag nabara or natigil yung daloy ng dugo, this is, it can cause paralysis, it can
Yes.
cause different manifestations of yung pagbabara dun sa particular part of the brain.
Parang yun nasa